Can you provide us with the details of the healthy lifestyle habits? I know you mentioned all the topics. Can you give example? How many hours of sleep is recommended a day? How much exercise? When you talk about other factors, food, for example, do you have guidelines that you give, or is it a personalized approach?
Actually, the science can give only rough idea of things, you mentioned personalization. That's true. There are a lot of difference from one person to the other. So science gives you only a rough idea. For instance, concerning food, science can say only if you eat mostly plant, that will be better for you rather than eat mostly animal products, something like that. That is only the rough idea. You work out the detail based on your circumstances. Okay.
And stay in an ideal body weight or something.
The ideal body weight is also the rough.
Also just very rough.
Just rough idea, yeah. And you can see easily if you are a bodybuilder, your body mass index can be above the recommended
overweight, obese level.
BMI, yeah. Actually, your body is perform very good. Mm-hmm. So it's only the rough idea. Exercise also the rough idea. That we recommend say 150 minutes of moderate intensity exercise per week, or 75 minutes of high intensity exercise per week, plus 2 episodes of strength training. It's based on the rough idea. But actually in detail, move is better than not move.
Right.
Don't talk about 150 minutes a week. Just move, okay? Better than not move. This is proven by science, but we don't bring it as a standard recommendation.
Just take a 10-minute walk every day.
Right.
Or anything.
And for strength training, for another example, one day in a week is dramatically improve your body movement in strength training. But the rough idea is 2 days a week of say sub maximum, what we call repetition maximum weight that you can lift 8 to 12
reps
per
body weight
per day and 2 days a week. That's the rough idea. But actually, just 1 day a week is work.
Right.
Improve your movement, improve your body strength significantly. So everything science says only the rough idea. Patient got to bring it into their own circumstances. About the sleep,
again, only a guideline.
Yeah.
7 to 9 hours.
Particularly elderly people, no one sleep up to 8 hours. Impossible, because they wake up 3 or 4 times a night. That is normal.
Right.
So the rough idea is 7 to 9. But in practice, we got to modify it into our circumstances.
Okay. Fair enough. As I said, obviously, wide range of age groups, different populations, that not everything is kind of personalized in the lifestyle medicine approach. You look at other metrics. Can you talk a little bit about the mind-body connection? You were mentioning we haven't covered a few of the other ones, the stress management, the social connections. How they play such an important role?
We separate these two things, Social connection is one thing, and research evidence strongly support that better social connection contributes to better health. That's for sure. Including length of life, quality of life, and illness. If you have better social connection, you have more length of life, better quality of life, and less illness. That's for sure, and quite clear. For example, people who married and stay with their spouse live longer and have better quality of life rather than people who live alone, something like that.
Mm-hmm.
But the other thing is what you mentioned about stress management, and that is the other thing. I would divide it into two levels. The superficial level, stress management, we talking about eating good food, get good sleep, do activity like Tai Chi, meditation, yoga, go out to nature, take break, something like this. This stress management in ordinary sense. And if you cannot cope with it alone, you seek assistance from psychiatrists or whoever that professional that can help you. That is the stress management in superficial level. But stress management in deeper level, it's about the word you use, changing identity. Because the source of stress actually is our thought.
Our own thoughts.
Nowadays, I mean, in the old day, when we live in the cave, of course, source of stress, physical environment.
Real stress.
Yeah, the tiger, whatever. But nowadays, source of stress are our own thoughts. And our own thoughts form the identity. That's why the changing identity is important in management of stress. We have got to learn to drop our thought, put it down, stay outside and observe our thought. That is the main point of stress management in deeper level.
Yes, you often say that you are not your thoughts, right? You are the observer of your thoughts.
Yeah. In the method of
to step out from your mind.
We got to make sure that we know that we are not this, we are not this, we are not this, so that we can stand and observe this. Yeah?
Right.
We are not our thought.
Yes.
Otherwise, we cannot come out and observe our thought. We are not our body. We are not our thought. We are not our body. We can stay outside and observe these two things. You can achieve this stance we call consciousness. The consciousness is the hardest word in science. We cannot conclude what it is, where it is, and how it performs. We have no idea. But you've got to step out to be consciousness,
right?
To be able to observe your thought in your body. And if you can do that, stress management at deeper level is possible.
Is this your definition of spirituality, or Doctor, how do you see spirituality?
Spirituality is all about the life energy.
Okay.
So it is kind of more spectrum that we start from. The life energy occur where we pay attention most. Okay. Because attention is source of life energy. What we pay attention to more, that is the source of life energy. Our passion, our life purpose, we pay attention most. That is our source of energy. So life energy starts from our passion, our life purpose. And to the end is the ability to step out from our identity, to stand at what we call consciousness and observe things. And by doing that, we can go through life smoothly. Peace, joy, and creatively. And that is spirituality. Start from our life purpose,
right?
Our passion toward moving from identity to consciousness.
I'm sure this is such a big issue in the modern world, right now. That's why I was going to say there are so many these days, so many apps, self-help apps and things like that. I wanted to ask you, what role do you see in technology helping with lifestyle changes? And what are your opinions on the future?
I think the technology can help in the superficial level, in
like
reminding.
My smartwatch.
Yeah, in reminding. A few days ago, I watched a podcast. An old lady, nearly 100 years old.
Wow.
She came out with a podcast, and every 15 minutes you check up by convulsion, in response to
the watch told
the
her
warning that it's time to move.
It's time to move.
And something like the mindfulness bells, people set up the bell
to meditate or
to remind them to stop and take deep breath and something like that. Short, briefly meditate. Yeah?
Right.
Yeah, technology can help in that level, can help in reminding, but technology cannot help you in moving yourself from the bury in the thought and identity toward consciousness.
Right.
What we call transcendenting. You got to do it yourself. Technology cannot help. And in the future, there are two scenarios. If people are successful in moving themselves from the ego identity to consciousness, they'll be happy people, healthy, happy, creative. That is the first scenario. But if they cannot, they will be permanent robot. And they will seek medications. And I predict under this scenario, the psychedelic medication will come. Now it start coming,
Already research, right? In the US and other places.
John Hopkins, psychedelic. You may not born in that time. It's 1965.
60s, 70s.
Yeah. Psychedelic it's legal.
Right.
So people use it a lot and use it to bring themselves out from their thought.
To another state of consciousness or?
To what they call consciousness. Yeah. In that state, they are awake, aware, but there is no thought. There is no ego.
Mm-hmm.
But later on, 30 years, recent 30 years, psychedelic drug become illegal.
Mm-hmm.
But now at Johns Hopkins, they start doing the research. One interesting conclusion from one research, at Johns Hopkins. In the old days, science, we believe that everything is in the brain. Your thought, your emotion, your hallucination, all come out from your brain tissue.
Okay.
And in the research based on one psychedelic, psilocybin is the name of active principle, something like LSD.
Yeah, the active ingredient in magic mushrooms and LSD or something.
Oh, yeah. Magic mushroom. Yeah. Psilocybin, yeah.
Yeah.
If in that research, they give different doses of psilocybin and they measure the brainwave, the EEG, and they record the experience of the conscious level, ego level and conscious level. Mm-hmm. If the belief in the previous science is correct, when the conscious level get bigger, the brainwave should be more active, right? But in that research, it turns out when the consciousness get bigger and clearer, the brainwave get smaller.
Oh.
To near that level, with the high dose of psychedelic, people get very happy with their consciousness situation. No ego, very happy, blissful, but nearly brain dead. So we don't know for sure where is consciousness, how it operates. We don't know. But there is the place that you can change your habits.
When the brain was working the least.
Yeah,
when
your brain tissue is working the least.
When you can turn your brain off, that's when people found the most peace.
Right. You can put it that way. Yeah.
Amazing. Is there any final thoughts you want to share about yourself? You have obviously, how many years have you been a lifestyle
20 years now.
Doctor? 20 years. 20 years in your experience?
I would say in Thailand, I am the first.
You were one of the first people in Thailand to do this profession. Now I think it's quite a common path for many doctors.
Now we have come to the point that we establish the specialty, start specialty training for doctors, and establish what we call Lifestyle Medicine Association of Thailand. Mm-hmm. So we come to the point that we get fully take off.
So can you go to university to study lifestyle medicine?
You got to go medical school first.
You have to still
graduate medical school, and you take specialty training in lifestyle medicine.
Okay.
You can do that in Thailand. Start from last year.
Wow.
Very new. Mm-hmm. Very new. And what I would like to say about lifestyle medicine for everyone is that chronic diseases, 50 years plus, we have proven that we cannot overcome chronic diseases by medications and invasive procedure. It's well proven. And scientific evidence point toward changing lifestyle, food, exercise, stress management, etc. is the way to go. We cannot achieve this changing if we cannot change our habit. So changing habit is actually the way to go.
As you said, just taking medicine is just mopping up the floor without turning the sink off, right? Mm-hmm. And you have a lot of evidence to prove this. Mm-hmm. I think we will wrap it up there. Thank you once again for all your insights.
You're welcome.
And we will see all of you in the next episode. Thank you very much.